From 2018 to 2022, 209 people died from drug overdoses in the Cumberland Plateau Health District, and the numbers are increasing. Many more people die of addiction-related illnesses and accidents. This is substantially more than Virginia and national averages. But why should you care? The presence of illicit drugs in a community affects everyone. People who use drugs look like you and me. They're mechanics, educators, homemakers, and executives. Black, white, brown, male, and female. For many, legally prescribed pain medications resulted in addiction. Substance use disorder is a disease of despair.
Growing up, I had my first job where I was passed a joint, marijuana, and I thought that I would be cool to fit in with the rest of the kids. And marijuana led to drinking, going to parties, and starting a social status for myself, and starting a social status for myself with the wrong people, which led to opiate addiction that had spread out to my family and my friends. I decided I was going to get clean and stay clean for 3 years off of all substances. But then with family, I decided to get back into it. I fell into an addiction with opiates, pain pills, which lasted about 10 years, so a little over a decade, unfortunately leading to me trying other drugs, such as methamphetamine or heroin. While I was using drugs, I was still living a regular life. I started using the pain pills every day to help me get through longer shifts at work. I was working at the factory at the time with my family, and we all just abused the pain pills so that we could get through continuous long hours throughout the day. I had quit for a while, but after following a terrible car wreck and I was prescribed another dose of pain pills at the hospital, I fell right back into addiction, unfortunately. Trying to be cool and hanging out with my friends, I would try a line of this or I would do a line of that just at regular parties, just a regular person, trying to fit in. And unfortunately, it led to my body yearning for it, which put me into a depression, which I felt like I needed to use more to feel happy again. It took all of my dopamine out. So I found myself in a reoccurring cycle of drug use, unfortunately, that just started chipping away at the happy person that I used to be, and it just kept putting me further and further down in the hole. If it wasn't for Virginia Harm Reduction Coalition, as well as these other peer recovery support specialist type programs, I more than likely would have been dead. There's times that I had overdosed just trying drugs out, and luckily the harm reduction had been passing out these Narcans for me to pass out to my friends. And little did I know, lo and behold, it saved my life one night, as well as the companies putting me into hotel rooms when I had nowhere to stay. I had found myself in a deep addiction, started using syringes and needles. I found myself with hepatitis C. And fortunately, not even knowing that there was a cure for it, they helped me into the program, the harm reduction did, and I was able to beat hepatitis C. I've been clean for 3 years now. I found God. I was able to find a man that I loved and get married and settle down. I've held a job for more than a year now, and I do have a beautiful little 3.5-month-old baby. So tell me, would you save me?
In 2020 and 21, more than 96,000 people died of overdoses throughout the United States. The economic burden of the opioid epidemic in Virginia is estimated at $3.5 billion. Labor losses in the United States are estimated to be around $1.9 billion. People who share needles are more susceptible to serious, potentially life-ending conditions. The estimated lifetime treatment cost per person with HIV at age 35 is $326,000. For hepatitis C, it ranges from $100,000 to $280,000 per person. But what can be done about it?
Harm reduction is key. Harm reduction is a set of evidence-based principles that helps provide supplies, education, and tools to individuals that are actively using substances to reduce the harms associated with substance use, such as overdose death and disease transmission. Harm reduction is meeting people where they're at. It's utilizing science, evidence-based practices to help improve the quality of life of those who are still in active use. We help by providing linkages to care, through things like hepatitis C, HIV, connecting individuals to abstinence-based recovery resources or medicated assisted treatment if that's something that they are ready to pursue. Harm reduction isn't just a needle exchange. Harm reduction is connection, it's compassion, and it's care.
Community health workers provide peer support and referrals in the Cumberland Plateau Health District. Teachers, police, and regular citizens are receiving training to administer Narcan, a nasal spray that revives someone in respiratory distress due to overdose. Awareness days, outreach, and collaboration are helping bring the issue of addiction to the forefront. Those who have been there and are willing to talk about it help put a face on addiction and harm reduction. But what else are we doing about it? If you think addiction doesn't affect or apply to you, neither did I. In 1996, I became addicted to opioids after being prescribed Vicodin for a boating accident. I spent 7 years in prison for these non-violent, victimless crimes for obtaining this medication. Before that, I was just an average guy, just like you. Help can come in many forms for people with addiction. Not everyone is ready or willing to be helped. Harm reduction efforts can save many from some of the negative effects of addiction. So tell me, would you have saved me?
One big way that you can help is you can come to us and we can teach you how to use Narcan and respond to an overdose in a way that can help save the life of somebody around you.
For more information about substance use disorder and/or harm reduction efforts in the Cumberland Plateau Health District, please contact the Virginia Harm Reduction Coalition.